And we count it all joy and privilege to see so many people here interested in the topic that has been, in many respects, been tabooed in our community, and so much so in the Black church. I want to basically give some context to why I sit here on the panel. When I got involved in the fight for HIV and AIDS, I became the first publicly tested pastor under the administration of Ron Bellums in the city of Oakland. Not because I was the stereotypical face of HIV, but because I knew many of the people who attended my church had contracted the virus. I'm a heterosexual male who desired to be a responsible pastor and father. And as my passion came, it came from a biblical conviction of the gospel simply saying to be concerned about those who are much akin to the leopards of biblical history that had no voice, to speak up for those who have no voice. In particular, what moved me to action was that I had a woman come to my church to give testimony. We was having HIV/AIDS Day, and she began to share her testimony. She was a lovely woman, well-dressed, St. John suit, but she found herself in a vicarious situation. She began to share that she wanted a loving relationship again. As she shared about her desire, she had been widowed, her husband passed some years ago, and she wanted to do everything right this time, the second time around. As she began to date, she was a deaconess in the church, and she got involved with this guy who was the chair of the deacon board. As she got involved with him, she dated him and she waited. She decided that it was right for her to marry him, and at the age of 65, on the night she consummated her marriage, she contracted HIV. That night began to change her life tremendously. She said to our congregation, had someone in the church that she had been so involved in gave her just a snippet of information that she should have got tested, her days would not be numbered as they were in that day. She lived with HIV for several years before she even realized what had happened in her life. So I say this to say that oftentimes we are afraid to talk about sex in the church as if it is some kind of demonized, ostracized, aloof exercise that we have a part of our pontification of fundamentalism. What I would like to say today that even as the city of Oakland was at one point one of the highest areas of infection, we're down 4%. But the reality is that I believe we can even eradicate this disease simply by testing. I'm reminded of the words of Paul Laurence Dunbar, the great poet laureate and playwright, that simply says these words. He says, "We wear the mask that grins and lies. It hides our cheeks and shades our eyes. This debt we pay to human guile. With torn and bleeding hearts we smile, and the mouth with myriad of subtleties we wear the mask. We watch the world be overwise and counting all of our tears and sighs. Nay, let them only see us while we wear the mask." My challenge to you today as a solution is time for the Black church to take off the mask and begin to test at every level, at every opportunity. Three things I want to leave with you before I miss my flight, and it's Palm Sunday tomorrow, and I need to preach a word because my preacher counseled on me at the 9th hour. I want to leave this message with you, that as we take off the mask, I want to encourage you, encourage your pastors to encourage people to get tested before premarital counseling. There should not be a pastor that will marry somebody with the idea of not getting each person tested for HIV/AIDS. I want to encourage you to take off the mask by pressing to reignite legislation that fund church and faith-based organizations to give testing locally in sites where people otherwise do not have the resources, where they have to choose between HIV medicine and or bus fare. We ought to have sites in local churches and faith-based organizations to give opportunity for people to not only know their status, but to be able to receive the drugs and the medicines that they need to create and maintain a healthy life. And last but not least, we have to take off the mask by providing contraceptives and creating a space in the Black church. We talk about everything else. We ought to be able to talk about sex, because death is not a taboo. God bless you.
here today. I first worked with Deborah on a very important campaign. I was invited to come for a discussion about how we could increase testing in New York City. And I will say that Deborah almost single-handedly brought the testing project to the Bronx. It was one of the most successful testing projects in the city of New York, and I thank you for making sure that New York was put on top of this testing issue, Deborah, and always will thank you for that. I also want to say we are in a war, and I'm proud to be a soldier in this army. New York has a great disparity going on. Our population over 35, fortunately, we're starting to see a diminish in HIV. But our population under 29 is flatlined right now. That's not good enough. If we can bring the numbers down over 35, we must bring the numbers down in our kids under 29. And of course, the biggest disparity is that we're talking about Black youth, who account for an estimated 57% of new HIV preventions in the United States. As John Martin talked about, African Americans are 8 times more likely to have new HIV infection than white-based population. This is not acceptable. That's the problem we're identifying today. Now I want to talk a little bit about why there's a disproportionate effect, and I'm going to start picking on the press. For the first time in 15 years, the New York Times had an article about Black and brown youth disproportionately affected by HIV in 2013 on December 5th. It shouldn't take 15 years for the press to pick up this story and to remind us that we have a duty to fight HIV/AIDS. And so there begins why there's a disproportionate effect and problem. Specific to youth, it's no secret, youth have a low perception of risk, right? They think they're invincible. We need to remind them they're not. There's a lower rate of testing amongst youth. 60% of all youth between the ages of 13 and 24 in the United States are unaware of their status. They're HIV positive, they don't know it. We need to test. There's inadequate HIV prevention education. We'll talk more about that in a minute. There's low rates of condom use. 40% of sexually active students do not use condoms. Gay, lesbian, bisexual, transgender youth, men who have sex with men.
Say transgender one more time.
I will say transgender one more time.
Thank you, darling.
My pleasure. Truly feel isolated as kids. They're youth. They're different than many of the youth around them. And it becomes very important to figure out how we support these youth. Substance use continues to contribute to HIV infection. Homelessness amongst youth continues to plague HIV infection. And then we have issues specific to African American populations with a higher poverty rate than other Americans. The socioeconomic issues associated with poverty include high quality health care, housing issues, HIV prevention education issues. You're going to hear that as a theme. And then there are issues of stigma, fear, discrimination, homophobia, and negative perceptions about HIV testing that must be stopped. Now that we've talked about why there's a disproportionate issue and why we have a problem, I want to focus on what works, solutions. We know that wraparound services work, that just getting someone to a doctor doesn't do it. If someone's homeless, HIV status is not their biggest problem. We need to work on homelessness. Poverty. The Affordable Care Act is a wonderful thing, but it is not a solution to poverty. And I think that too many people believe it is. We have people with food insecurity. That's going to take a top notch over HIV. Hungry people have a hard time worrying about their HIV status. We also need to start having frank conversations about sex. It needs to be culturally sensitive. With youth in particular, it needs to be clear and blunt and a language that youth use. We sometimes do a dance around talking about sex and use all kinds of euphemisms and all kinds of crazy conversations. The fact of the matter is we need to talk about sex. I have an expert sitting here who's going to tell you more about social marketing than I ever can, but it certainly is the tool for us to reach youth and to begin to get youth to understand that they need to be educated. It's not necessarily going to do the whole education, but it needs to bring youth in. And it needs to be culturally sensitive. Now I'm going to talk about something that's a sensitive subject, and some people are going to disagree with me. But there is a tool called PrEP, pre-exposure prophylaxis. We are giving people who are healthy the antiretroviral drug that helps people who are HIV positive get to a zero suppressed level. People who are taking PrEP are, by all indications, if they're taking it as prescribed by their doctors, are not getting HIV, even if they occasionally have unprotected sex. This is another tool in our tool chest, and we need to think about using it. And disproportionately, Black, African American, and people of color are not being offered this option. People need to be educated about it. People need to know it's an option. People need to be aware of it. And it's very, very important to know everything that's out there, every tool in the tool chest. I work at Gay Men's Health Crisis. I think you heard Deborah say that. And we had a program called Outstanding Beautiful Brothers. In fact, we still have that program. And that program was modeled after the fraternity sorority models of college. What do fraternities and sororities buy young people? It buys them a network, a lifetime network of support, a network that helps them get jobs, a network that helps them get housing, a network that looks out for each of their brothers and sisters. But we don't have such things if you don't have the privilege of going to college. And so we created a model that built this type of network. That network helped with resume writing, it helped with networking, it helped with peer-to-peer support, it helped with job searches, etc., etc., etc. Why am I talking about this program in the past tense? Because this program was funded by the Substance Abuse Mental Health Services Administration, SAMHSA. SAMHSA chose to end the whole cohort of funding when this ended. This was an award-winning program by SAMHSA standards, and it was stopped by lack of funding from the government. So the question that it makes me ask and put out there is, do we have the political will to end the AIDS epidemic today? By all indications, we don't. We have tools, but we don't have the political will. And it's all of our jobs to have that political will. We've heard Barack Obama just yesterday announce and talk to all of us about voter rights. That's your voice, that's my voice, that's our voice, that's political will, and I urge you, please take it up. Thank you.